According to the University of the Free State Chancellor, Professor Bonang Mohale, black people are more likely to contract COVID-19 and less likely to be tested and treated and more likely to die if they contract the virus. He joins me now to discuss this. Professor Mohale, thank you so much for your time tonight. One of our callers tonight, I'm sure you would have heard, Tapelo, saying that, this pandemic has really hit hard at the poorest of the poor. Do you agree?
In fact, we're expecting that, but I think before I start, maybe some sympathies and condolences to the Mabena family on their profound loss, Yantate Bob Khomutso Mabena. But when you think about it, 26 years into democracy, all of us collectively, individually and severally, have not succeeded in eradicating the legacy of apartheid. If you look only at apartheid's spatial plan, it has ensured that black people live on average 40 kilometers from their place of work. Therefore, they spend on average 40% of their salary on transport, when they are indeed spending more than 40 minutes a day, every day, one way to their place of work. That's why we've got towns like Vergenoeg, because they wanted to make sure that we are far enough from white suburbs. Secondly, when you look at even the protocols that the World Health Organization says we should observe to ensure that we are not decimated by this pandemic. One, it's about working from home. Number two, it's about social distancing. Three, it's about self-quarantine. And if you're lucky, you have some running water, wash your hands by observing basic hygiene for no less than 20 seconds. Now, if you live in an informal settlement of Alexander, just 4 kilometers away from the richest square mile, which is centered just across the bridge, we don't even have official statistics. We estimate that there's about 170,000 to 750,000 people. How can they do self-quarantine? How can they do social distancing? The same with Soweto. In Soweto, official statistics say there's more than 2 million people. This is almost the same population like the countries of Botswana, Lesotho, Namibia, and Swaziland. But unofficially, we know that there's at least 3.5 million people in Soweto. But most of them are 4-roomed houses with only 2 bedrooms. On average, 5 people live in that household. How then do you do self-quarantine when there's only 2 bedrooms? How do you do social distancing? And then lastly, the Stats SA tells us that only 10.4% of households have direct access to the internet. So if you are an employer, you send your own people with a smartphone and indeed a laptop to say work from home. In our taxis that ferry 13.5 million of our people a day, every day, is the shortest way of making sure that they are definitely going to be confiscated. Therefore, I think we should call it what it is. There is both systemic and systematic racism in the world against black people. And in South Africa, it's even worse, because here we are dealing with 425 years of colonialism, of apartheid, and indeed of separate development.
And some have argued tonight, especially when we put our poll question tonight out, in fact today out there, some were saying that apartheid, even in this pandemic does not even begin to count as a factor because, there's corruption and rampant corruption, which South Africa is still battling with. Do you agree with that sentiment?
In fact, I would go further and say there is no economy that can survive in a short period of time and in quick successions the self-inflicted harm that we have seen in this country. So first, the 9 wasted years of rampant and industrial scale state capture. Number 2, we now have a technical recession. Number 3, Moody's has decided to join 2 others and rate us below investment grade. Number 4, the COVID-19 finds us prostate, face down, already finished. As if that's not enough, we now have to contend with Eskom's rolling blackouts, which started in January of 2008. In 12 years, we have not fixed the supply of electricity, and yet we know that energy is the fourth means of production. Now we are beginning to suffer from intermittent water supply by rainwater. As if that's not enough, now we have these COVID pioneers who steal from the sick, the vulnerable, and the dead, where the intent was looting. When the president announced the 500 billion social and economic stimulus package, they saw an opportunity to line their pockets. They have been both brazen and absolutely fearless, but simply continuing with what is now probably in the DNA of our wonderful movement, and indeed in the DNA of Rolihlahla, Nelson Mandela's dream country.
And let's talk about, the demographics as we round up our discussion tonight. Let's talk about the numbers, because there are some that have been calling for the Department of Health to make the, the numbers of, by demographics basically known when it comes to COVID-19 confirmed cases. We have not seen those cases come out, and yet, you and various other people do say that it is affecting quite a number of black people. How easy will it make the fight against COVID-19, and how will it help for us to know and get a sense of the demographics?
So first of all, State SA keeps these statistics by age, by gender, by race. And why we are not sharing this widely, it is absolutely beyond it. But we know that 58% of the deaths, not just the infections, are attributed to women. And we know that in other countries where they keep the stats, like the US of A, African Americans are 1 in 10 as part of the population. But their deaths account for 1 in 4. We know that African Americans have 4 times more chances of dying from COVID-19 than any other nationality. In South Africa, those numbers should not be any different. And yet the Western Cape has been very proactive in sharing how they've spent their money for PPEs and therefore COVID-19 in general. They've published their contracts because probably they have nothing to hide. Why is it not possible to the other 8 provinces? So as we celebrate the fact that the president has now come up with this ministerial team to look at only processing what has happened during the PPE scandal, where all of us need to hang our heads in shame, I think we need to now see the top state capture miscreants being in jail. It's been 10 years that we've been talking about state capture, and yet we are yet to see only 1 person that has been jailed as a result of that. 4 commissions of inquiry later, concurrently, simultaneously in parallel, damning evidence, people by name, evidence being produced, interrogated. And I wonder why the reluctance to throw a few of them in jail, to send a strategic conversation that says, not in our name, and we are not going to allow the graves of our fathers to be spit at because we did not go to struggle just for people to be self-centered and egocentric. We went so that we can improve the quality of lives of the majority of our people. What we want to do is to pick the bottom up and bring them into the middle class so that nobody goes hungry. At the moment, 18 million people are on social security. Now we have set 350 rands each to the other people that are not part of the 18 million people, swelling the numbers. And yet we know only 16 million were gainfully employed. But 3 million of them have now lost their jobs as a direct result of the pandemic. As if that's not enough, our economy is going to contract by a minimum of minus 7.2% this year. The world GDP has contracted. In fact, every single solitary one of the major companies have announced some sort of a restructure. Therefore, I think we are indeed in a spot of